Next, from Springfield, we attend a press conference where several health officials express their concerns over what they say is a public health funding crisis in Illinois, as healthcare providers have been forced to make deep cuts and eliminate critical programs throughout the state. This runs about 30 minutes.
Well, good morning. My name is Craig Bentham. I'm the Public Health Administrator for Stevenson and Carroll Counties in Northwest Illinois and the President of the Illinois Association of Public Health Administrators. We are here today to call on lawmakers and Governor Rauner to work together to stop the erosion of the public health system in Illinois. Public health in Illinois has faced significant budget cuts and at the state and federal level over the past several years. This year's cuts, plus the uncertainty of having no state budget, has accelerated the erosion of the public health system. As a result, we have local health departments all over the state struggling to maintain services. In fact, by the end of October, 36% of the 97 local health departments have eliminated critical programs, cut staff, and reduced hours of service. That is up 11% since September. Local health departments struggling the most have less local government support, less diversity of funding, and many have high rates of poverty, so the need is overwhelming. As you can see from the map, rural Illinois is disproportionately impacted. Our map blue areas are the areas where we have either cut services, reduced services, or laid off individuals. What is public health? Some of the most important services we do include restaurant inspections. These ensure safe handling of food, so when you go to a restaurant, you don't get sick with salmonella or eat in an unsanitary environment. This is a feature of public health that individuals, you don't need to walk into a public health department to receive our services. Our staffs have educated low-income moms and parenting and good nutrition. Local health departments in our communities have worked with community partners to address priority health problems, including obesity and tobacco use, smoking. We work with schools and work sites to build healthy environments, and we offer the general public at-risk groups access to immunizations and flu vaccines. As you can see, everyone benefits from a strong public health system. In fact, we are only as strong as our weakest partner. What does that mean? One of our most critical functions are to protect against the spread of infectious diseases, such as mumps, measles, and Ebola. These diseases know no county boundaries. Anyone in Illinois is only a day's drive or less away from potential exposure in a community where the public health system is drastically weakened. A crumbling public health system makes us all vulnerable, whether you live in Chicago or Cairo. We are all in this together. We are calling on the state to pass Senate Bill 2178 and its companion bill in the House, House Bill 4311. This legislation appropriates $17.1 million to reinstate local health department grants which provide funding to each of the 97 local health departments. Many public health departments will not survive without this funding. We are also calling on lawmakers to make a holistic approach to public health programs and take the necessary steps to protect this crumbling infrastructure. To our lawmakers, you have the power to stop the erosion of the public health system. You have the power to fund the local health department grant. You also have power to agree on a state budget for this year and to begin pay back the local health departments that have continued these services for their communities, not knowing when or even if they would ever receive reimbursement from the state. We are here as your partner and look forward to working with you to restore the public health and the public health for the people of Illinois. Thank you. Next speaker is Elizabeth Patton Whiteside from the East Side District.
Good morning. As he stated, I am Elizabeth Patton Whiteside, and I am the administrator of Eastside Health District in East St. Louis, Illinois. Eastside Health District has been a lifeline within our community for over 75 years. The clinic resides in St. Clair County, and St. Clair County has been deemed one of 14 counties on what's termed the poverty warning list, with a poverty rate of 19.1% by the Social Impact Research Center in Chicago. It should be noted that East St. Louis's poverty rate is 35.1%, and the state of Illinois' poverty rate is only 10.7%. We serve the 4 poorest townships with a population of greater than 65,000 clients. Eastside Health District serviced greater than 30,000 clients last year, and the number of citizens requesting services is steadily growing. It is not declining. I have been forced to lay off 65% of my staff. I've reduced our hours of operation. I've eliminated critical programs, and the deterioration of the infrastructure did not happen overnight. It has been a steady decline, which is the result of underfunding and is compounded by the current budget impasse. For fiscal year 2016, I have been forced to completely eliminate 2 of the 3 school-based health centers, our breast and cervical cancer programs, our HIV prevention services, our dental services, our prostate services, and tobacco services, all shut down. We have significantly reduced services for family case management, nursing, Ryan White for HIV, WIC, which is for a nutrition program for women, infants, and children, our environmental health services, breastfeeding peer counselors, and STD services. These services are greatly limited, and they are on life support at this time. We are operating on a shoestring budget with a very uncertain future. We're one of those health departments that's considered in the red zone. Essential staff are quitting. Why? Because of the layoff, and they're seeking other employment. This is especially noted in our nursing department. You can't run a health district without a nursing staff. Currently, we only have 2, let me repeat, 2 full-time nurses, and they take care of our nursing clinic and our communicable disease program. We need at least a minimum of 5 nurses. The environmental health department has only 1 sanitarian, and as Craig said, we're the ones who are supposed to do your inspections of your restaurants and all of that. So we're short 2 sanitarians at least, and that, as I said, hinders the retail food inspections, disease outbreak management, the vector program, any well inspections, and of course, emergency preparedness staffing. With the school-based health centers closing, I have 1 school district that has greater than 500 high school students that are out of compliance with immunizations. And I told you I only have 2 nurses. Clearly, this is unacceptable and presents a significant and potentially catastrophic public health implications. Illinois lawmakers must act immediately to change the path of this downward spiral. The safety and well-being of our children and adults that we depend on is resting in their hands. Thank you. I would introduce Carol Knight, who is a client of Eastside Health District.
Good morning. My name is Carol Knight, and I'm from the East St. Louis in Southern Illinois. I am here to talk about the real-life implications of a deteriorating public health system. I am a proud grandmother of 2 beautiful young ladies. My eldest granddaughter is 13, and my youngest is 7. They are victims of a failing public health system. My 13-year-old granddaughter, to prevent HPV and to avoid this turning into cervical cancer, is supposed to get a series of 3 shots within 6 months. The timeline for this is strict. there is no room for error. Unfortunately, because the Eastside Health District has cut its hours and lost so much of its staff, we are struggling to find time for an appointment. My granddaughter is on the honor roll at school and is not one to miss class. It is critical that she receive ongoing medical care to make sure she is cancer-free. The lack of funding for the public health is making us choose between her health and her education. This is unacceptable and puts a huge degree of stress on our family. Now let's talk about the dental. My 7-year-old granddaughter was in horrible pain because of problems with her teeth. She brushes her teeth twice a day, but the fact remains that there is no public dental program in our community. As a result, we had to take her into St. Louis to get treatment. Because of the delay, they ended up pulling her teeth. For us, preventive care is not an option anymore. We are just trying to keep up and needlessly suffering. Finally, we learned that we were behind on their immunizations because there isn't enough staff at our local clinic to meet the demands of the community. People are leaving Illinois for work, to live, to open up new businesses. We are going to have to leave Illinois to be able to access basic public health services too. I am hoping that our elected leaders will hear my story because I am not alone. A strong public health system is an essential link to a strong community. Thank you. I'd like to introduce JERROD WELCH, Adams County Public Health.
Thank you, Carol. Good morning. My name is JERROD WELCH. I'm the administrator at the Adams County Health Department in Quincy, Illinois. Like Elizabeth and like Carol, the people that we serve are experiencing those same steady decline in services that you're hearing about. To be honest, I'm worried not only about the decline in the services, but what we're setting ourselves up for, which is potentially uncontrollable disease outbreaks. Downstate public health departments are especially at risk, primarily because of our smaller tax bases, our more rural populations, and the immense geography that we serve. It is much more challenging. We also have a situation where our local tax bases are small, and we rely more heavily on state dollars. When these dollars are interrupted, as they are this year, what we see is an interruption in services. In 2009, Adams County Health Department had 19 nurses. Today, we have 11. We've lost over 25% of our staff in the last 10 years. In fact, our budget in 2008 was $3.9 million. Today, it stands at $2.7 million. We've lost $1.25 million in this time frame. We've reduced or we no longer offer important services, including drug and alcohol prevention and education, vision and hearing screenings, violence prevention, breast and cervical cancer screenings, and teen reach. We also see erosion in services such as family case management, particularly impacted this year. With recent emergency events in Adams County, including a major windstorm followed by Legionnaire's disease outbreak of national significance, we're having a challenge even staffing our routine clinics. We find ourselves in our WIC clinic and in our immunization clinic short-staffed on a routine basis. In fact, in December, we're going to be closing our immunization clinic one day a week just so we can keep our staff serving people appropriately the other days. It's scary at this point. This is not just Adams County or Eastside Health District. This is a trend, as you see, across many of our public health system in Illinois. It's vitally important that our lawmakers address this issue by passing Senate Bill 2178 and House Bill 4311. Not only that, it's time to take a holistic approach. We need to look at this crumbling system, and we need to prop it up in the future. Our public health system serves our most vulnerable populations and improves their quality of life. Without it, we will see, as Elizabeth said and as Carol said, an exodus from Illinois and further reductions. Thank you. Our next speaker is Kathy Dre from the American Lung Association.
Good morning. I'm Kathy Dre. I'm Vice President of Advocacy for the American Lung Association in Illinois. The American Lung Association has worked with the local health departments in Illinois for many years. We consider the local health departments to be our most important partner. We work together to help people to quit smoking. And if you don't think that that's important, as we look at the state of Illinois budget, almost $2 billion is spent every year treating Medicaid recipients who have tobacco-related diseases. The state of Illinois should be doing absolutely everything they can to help people quit smoking, not cutting programs. Together, the local health departments and the American Lung Association and many other partners worked to pass and enforce smoke-free Illinois, and more recently, smoke-free college campuses. We continue to work together to pass both local smoke-free park policies and smoke-free multi-unit housing policies around the state. Today, Illinois children are growing up to expect public places like restaurants and bowling alleys to be smoke-free. They have never heard, do you want smoking or non-smoking? This is very important social change, and it's what smoke-free Illinois is all about. The local health departments, as you've heard, take care of a lot of things that the rest of us expect and even take for granted. We expect our food and our water supply to be safe. Did you know that local health departments inspect restaurants and school cafeterias and hospital food service programs and all of those little food booths at your festivals and fairs? They train food service workers to safely handle our food so that we don't get sick. They provide immunizations and well baby checkups and vision and hearing screenings, as well as communicable disease testing and control. These are very basic, critical health services, and they're all things, like I said, that we take for granted in Illinois and in the United States. For years, I have worked to keep the money for the health protection grants for the local health departments in the state budget. Not only do we need this money to be appropriated now, we need to make sure that it is a priority in the future. We cannot risk losing our local health departments and the critical services that they provide. You know, there are places in the world where government does not pay for public health, basic public health services. Do you know what we call those places? We call them third world countries and underdeveloped nations. The critical services that our local health departments provide are what separate the United States and Illinois from third world countries and underdeveloped nations. We can't wait until the meeting that's expected on November 18th. We can't wait until January for a state budget. These programs need to be funded now. The money needs to be appropriated so the local health departments can get their funding. We ask that the legislature immediately pass Senate Bill 2178 and House Bill 4311 to fund these local health departments and their important and critical programs. Thank you, and I would like to open this up for questions.
What's the source of the 17.1 million? How much of this is GRF?
I believe all of that is GRF.
Well, the closest that our heroes upstairs have come to a balanced budget has been to pass one that's $4 billion out of balance and for the governor to veto it. And that's as close as they came, I think. So what services could be cut or what revenue could be raised to get to a balanced budget?
I believe.
Mike, please.
Sorry.
Thank you.
Well, that's quite a large question, I mean, to reach that $4 billion. There are other activities, such as the HEAL Act, that they're working on that could provide additional dollars for these type of services.
That's soda tax?
Yes, that is correct.
For some of the local health directors up there, how do you prioritize where you're cutting services? How are you ranking where you are cutting costs, staff versus programs, that type of thing?
Well, I'll tell you what, I'm going to let Elizabeth take that question, if you don't mind.
Thank you.
There's several other colleagues of mine that are here.
I was one of the first health departments that started with the reduced hours and cutting back staff, and I had to base that upon They said we may get funded, we may not get funded. I had to actually look at all of my programs and the year's worth of services that we had done to see which programs normally was underfunded. Then I had to turn around and look at the critical services, such as the women's, infants, and children's, our babies, and try to make sure that they try to get their immunizations and their WIC, because they need their formulas, they need all of those vouchers. So I had to go in and look at all of my programs and see which ones could I just totally step back from, and hopefully someone else would pick up the slack. So I sent out a notice to all of my grantors to tell them that I was reducing services and asked who can take some of this burden from the health department at this time until we find out whether we would get funding or not.
Any volunteers?
No. Being truthful, no.
Of the, of the different health departments, you say 36% are making cutbacks. Are any going to be closing, or have they closed entirely?
Not
And
to
can
my
you go to the
knowledge.
microphone?
I'm sorry. No, we do not have any health department on record that is closing. But looking at the progression of 36% at the end of October, and that's 11% more after September, it gives really a telltale sign of what's going to happen if something isn't passed or the funding doesn't come through. I would expect this map to become even more blue, not for election purposes, but as far as health departments affected. Right now, what we're looking at is obviously reducing services, cutting programs. The problem gets to be in our community, they expect us. They expect us to keep on providing the same amount of services. And also, it's a question of looking at public health. If we're doing our job and doing what we're supposed to, you shouldn't hear from us. You won't hear about any Legionnaire, you won't hear about Ebola, you won't hear about Salmonella. That's a lot of the problem.
If they pass the 17 million, does that take care of you until the next fiscal year, or how long does that last?
Well, that's, the 17 million is probably approximately about, I will say, 35 to 40% of the cost. The rest of the cost of providing those particular services come from fees and local tax dollars. But the 17 million is woefully underfunded. 17 million, yes, it will be a temporary fix to a problem, but our contention is that the public health system hasn't seen increases or kept up with even the CPI over the years. There has not been an increase. But a direct answer to your question, will it help out? Yes. Does it solve the problem? No.
Can I add something to that? I would also say to your question regarding have health departments closed, I would ask if a cutback on a Thursday, Friday closure is indeed a closure. If you have a disease outbreak that happens on a Thursday and you've closed for 2 days so that you can keep your doors open for 3 others to solve these problems, you're looking at a 4-day window. This is common. You know, we have done over the years a marvelous job of patching where we have to patch to keep this thing together. The point here is the weakest link in the chain is what breaks, and we all know that. And we have a lot of weak links right now in our chain. We will see more and more continued disease outbreaks. If we have programs that close, you can ask the participants of the program if the health department closed, and guess what they're going to say? Yeah, because their part of the health department closed.
You know, I think most people would understand that you, as you mentioned, inspect restaurants, and they would understand and follow that. I don't think the average person, though, understands as far as treatment. How is it what services you provide compared to people just being able to go to a local hospital for treatment?
Well, the populations that we serve many times access us as their primary access point for the medical system, be it providing treatment on site or be it referring them to other places that can get them treatment. So they have lost the conduit into the health system in many cases. A lot of these services don't get provided. You know, if we look at family case management services that we're reducing in our county, those services simply go away. There's nobody else that's providing those.
What is family case management services?
Those are assuring babies get a healthy start in life by assuring healthy pregnancies. The goal of the program in the longer term is to reduce the overall health cost of an individual over their lifetime by giving them an early start that's healthy.
And someone mentioned Legionnaires, and it seems to me that, and it might just be the voices in my head, but it seems like some of the diseases we thought would wipe out, measles, mumps, Legionnaires, these things that we, you know, I mean, is it my imagination, or are they making a comeback? And it seems like a bad time to...
Well, certainly you look at the vaccine preventables, and if you have reduced access to vaccines, you're going to see a comeback. Yes, some of these diseases that we've worked hard to keep control of are continuing to rear their ugly heads.
We talked about the Legionnaires outbreak in Western Illinois. Can you just clarify again, and maybe it's a question for Craig, was this outbreak a derivative of a lack of funding or cuts in staffing, or is this just something that, you know, the spread could perhaps be affected?
Yeah, no, this disease outbreak would have occurred whether or not there was a reduction. The issue here is the local jurisdiction, which happens to be mine, has now invested so much staffing time to respond to this that we are carrying a time liability that has made it nearly impossible for us over the next 6-month window to operate normal services. We have people that have banked up so much time through this response. We're carrying a $30,000 to $40,000 liability in time alone as a result of that.
I'd like to comment one more about what you had just indicated about going to local hospital. That there is an issue that hospitals will have a much more overhead than a local health department. And we're trying to be in the business, still in the business of prevention. So to send somebody who is low income that may have health insurance or Medicaid to the hospital for prevention services is not the direction that we really wanted to go, because it will cost more by going to their local physician, or as we'll find with a lot of low income and Medicaid, if you ask them what their health insurance is or their health care, they'll say to you the emergency room, which is quite an increase of cost to the state and to the hospital system and public health system.
So Tuesday's the day. Tuesday they could pass this bill. They're going to come in the 10th, and we hope they pass and give it to the governor.
Absolutely. Actually, I can take that one more step further. I hope the governor signs it.
Is this recurrent? Is this, are we going to be in this situation 12 months from now? Or is this bill recurrent every year?
Well, this bill is just requesting, asking, and pleading with passing of that $17 million that's been the appropriation for many years. So I'm hoping that we don't have to have this bill passed every year. This is, in this odd year of budget, is why we're pushing for this particular bill to get passed.
All right, so typically you get 17 million, or how much do you typically get from the state budget, number one? And how is that money allocated to the different counties? Is it based on population or what?
Well, the 17 million is the overall state, and that's what was appropriated out. Now, the local health protection grant, for dollar-wise, there's a base amount, and then it's appropriated based off of population. So a smaller population will receive a base grant plus, the number of population, and then you'd have a larger county who would receive the base grant also, but receive a much larger population portion of the local health grant.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.